Boy, healthcare reform is going to be at the top of the list for everyone this year. The Affordable Care Act, as it is being implemented, we're very fortunate to have very good people at NACDS that understand the issues. They stay very involved. They're great communicators. We're going to, every month on our executive call, that's going to be the top priority we're going to be working with. We're going to make sure that everyone understands the implementation and the questions that arise from those meetings and from the calls that come in. We want to make sure that our members understand where this is going. Also, when you take a look at this, what an opportunity. You know, we're going to have from 30 to 40 million more individuals that are going to be looking to us as an industry to provide healthcare service. If we go about this right and we take care of the customer and we maintain access to that customer for all pharmacies, we're going to do a great job. We're being asked to step forward and produce and show that we can really affect medication adherence. When we do that, we're going to change the industry and we're going to change the healthcare of the country. I'm really looking forward to it, and I honestly believe that our industry is up for the challenge. You know, our country every day has 10,000 people turning 65. That's just an astonishing fact as we're moving forward. We've got a $290 billion issue of medication adherence that we're trying to deal with, and that we know we have to handle, and we know we have to move forward and in order to try and help with the system. We also know that there's going to be from 30 to 40 million individuals that are going to be coming aboard with the Affordable Care Act. To be successful, we're going to have to maintain access to those patients. We're going to have to step forward, and we need to get to the point where we realize that there's more to taking care of our patients than just putting pills in a bottle. We have to get to the point where we have face-to-face MTM, where we're working with our patients on their medication adherence, and where we continue to drive home that, and we can prove it. One of the things I'm very proud of with Thrifty White is we have over 24,000 patients who next month will get all their medications on the same day. Now, what does that do? When you start thinking about it, and you've got a situation where, especially in rural America where we live, if someone has to come to the drugstore 2, 3, 4, 5, we have people that have 20 medications on medication synchronization. It's very difficult to maintain those pills on a regular basis. And as we provide these services, we're seeing their adherence continue to grow. And along with that, we're developing very loyal patients. The doctors love it, and it's programs that need to be brought forth in order to help impact that $290 billion issue. Once again, I'm going to say this: we need to maintain access to our patients in order to provide the health care that they need and deserve. Some of the things that we're doing at Thrifty is when a person signs up for MedSync, you're having 3 touch points a month, first of all. We've brought all your medication together. You're getting a call 10 days out, and they're asking, has there been any changes to your medication? Have you been to the doctor? You know, what's changed? If there has been any changes, we're automatically taking that to our call center, and we're working one-on-one with the patient to determine what the situations have been. The medication gets adjusted. At that same time, that information is being transferred over to your doctor. So what we're doing is we're taking your medication regimen, we're making sure your doctor stays informed, and we're following up with you the first time that month. Then the second time that month, and that we're following up to just say, do you know your medication is going to be ready in a couple days? And how do you want it? And a piece we'll mail, we'll deliver, you can pick up, you can do anything you want. And from that standpoint, we're making sure that you're going to get your medication. And we try and set up an appointment at that time where we can sit down and talk to you. You know, we believe that the MTMs and CMRs are a very important role moving forward. And if we can be preventive with illnesses or situations where it could cause someone to wind up in the hospital, we're going to take care of you, and we're going to make sure we can affect that $290 billion spend once again. Compliance and adherence isn't just putting something in a mailbox. And compliance and adherence is talking and working with the customer. So at this point in time, you know, this next month, we're going to have 24,000 customers they're going to be communicated with at least 3 times. We're going to make sure that their medication is proper. If it has changed, the doctor has been notified. We're going to make sure you get that medication, and we're going to make sure that when you come in and work with us at the store, that you're talking directly with the pharmacist, and if there's issues, we deal with those issues at that time, rather than putting pills in a bottle. We're changing the model. I honestly believe the role of the pharmacist is not to put pills in a bottle. The role of the pharmacist is to work with the patient and keep them healthy. What do we charge for this? Nothing. Why? Because when you take a look at this, what we're trying to do is we're taking adherence from here to here. This is a paradigm shift for our organization, and someone has to demonstrate that this can be done. If we go out and charge a lot for it, we wouldn't have the 24,000 people that are on it at this point in time. We wouldn't have the results that we had. We wouldn't be sitting here right now talking about this. Where we're going to make up the efficiencies and where this is going to work is 84 extra days a year in coverage and medication. Our customers are loyal. We can fill it more economically centrally. Now, that being said, we didn't cut the staff in the stores back to the point where we took that out for a savings. The people at the stores now are working one-on-one with a patient. And that's where we need to go. So, is it a capital expense? You bet. Is it a result that's going to pay for itself? You bet. Is it something that we need to prove to our representatives, to the government, to third-party plans, to everyone out there that MTM and medication adherence is part of the solution? You bet. And someone had to step forward with it. We decided we wanted to do that, and as an employee-owned company, we said we had 2 directions we could go. We either had to go fast and cheap and cut everything back to the bone, or we wanted to go where we can supply solid services, take care of the patient, and medication adherence. We chose medication adherence, and that's where we're going to stay. I look forward to it. You know, when the names you just read off, some pretty impressive individuals, and I've got some big shoes to fill, but I'm looking forward to the event. You also take a look right now at this point in time. Look what Jim Whitman and Steve Anderson and everyone from NECDS has put together. They've taken an event and they're going to put something together in August in Las Vegas. It's going to have an opportunity to bring marketplace, pharmacy and technology, and logistics conferences all together. And along with that, we're allowing our teams from all of their chains throughout the country to bring their complete teams together. So I know from Thrifty's perspective, we're really looking forward to bringing everyone out there because we're going to be able to talk to all the vendors, we're going to be able to come up with ideas and solutions to problems, and then we're going to be able to convene that evening and go through what we've seen throughout the day and actually make some plans and move forward. You know, I just know everyone is going to really appreciate the show, and as I'm there, if there are any issues, I certainly would like to hear about them, and I plan to be very involved.